Happy Monday. I'm Ken DeCoster. We're going to start by saying good morning to 16th District Congressman Don Manzullo. Don, great to talk to you. Thank you for your time.
How are you this morning?
I'm fine, thank you. Before we get into the negatives, are there any redeeming qualities about the health care reform package approved last night by the House?
Yeah, the biggest one is that it expands community health centers.
How so?
Like Crusader Clinic.
Okay.
And that's huge. In fact, the expansion of community health centers is probably the finest way to get health care to many Americans. Not necessarily health insurance. It's a big difference. But to get the health care services to the people that are uninsured. And that's the goal, is to do that. I mean, there's the 2,800 pages, you've got to have some good things in there. It allows for I think it allows for purchase across state lines of insurance, but I'm not sure. But the redemption comes at a big price.
Did you read the whole thing?
I couldn't. I read the 1,100 pages in the House bill, H.R. 3200.
Okay.
Then I read several hundred pages amendment to that, and then the Senate picked it up, and the Senate bill changed daily depended upon how fast the members of Congress would sell out. I use the word sell out because that's what happened. Senator Nelson of Florida sold out because there the people get to keep Medicare Advantage when the 17,000 constituents I represent get Medicare Advantage ripped from them. Senator Landrieu of Louisiana sold out. She exchanged her vote for more Medicaid money. Senator Nelson of Nebraska sold out in exchange for the so-called Cornhusker thing. And sellouts all over the place in Colorado. Some people have been exposed to something in a mine, and even though they're nowhere near Medicare age, they were given the ability to go on Medicare. Connecticut got a $100 million hospital. Ken, I want to tell you something. The American people are fed up with these backroom deals, with knowing that the senators, members of Congress, are selling out, selling their souls. I mean, I am really, really upset because even if you end up with a bill that may or may not work, it's the process that stinks, and that's why people hate Congress.
What impact will this bill have on small businesses?
Well, what it's going to do is estimates show that between 3 million and 5 million people will lose their jobs because of the harsh employer mandate forcing people to get insurance. And overall, it increases the cost of insurance. Let me give you just two reasons. The state of Illinois is broke. I don't have to tell you that. You look at today's headlines, and you see that literally thousands of teachers across the state of Illinois are being laid off. They're being ripped because there's simply no money to pay them coming from the state coffers. And at a time when the economy is in a tailspin, when the effective unemployment in Rockford is at 27%, because you have to have 7 percentage points to the 19.6% that we have, here comes a bill that increases taxes dramatically. In fact, the Speaker Pelosi's idea of insuring Americans is to add 16 million Americans to Medicaid. Illinois will see an increase of about 330,000 people added to Medicaid. And Medicaid reimbursements are so low, a lot of doctors won't see the patients. And in fact, in the state of Washington, Walgreens is saying, "I'm sorry, we will no longer honor Medicaid prescriptions." I mean, that's no solution. Just add people to an already overburdened system. Illinois means an additional $400 to $500 million in Medicaid expenses, unless the federal government fulfills its promise, which does not occur in many cases, of reimbursing the state of Illinois to the extent of the increase under this plan. But Ken, one of the things that I found to be personally aggravating, you remember Frida came down with cancer.
Yes, I do. Is she doing okay, by the way?
thank God, yes, she's doing. She's doing every day is a miracle, and in June we celebrate 4 years. But when that tumor settled in her vertebrae and exploded that bone, this bone shrapnel all over her back, the neurosurgeon went in and meticulously removed all these pieces of bone from around her spinal column, and then he took the vertebrae that was destroyed by the tumor and he replaced it with a titanium vertebrae, along with a post in it, did skin grafting and everything. That kept her from a wheelchair. That titanium brace and the life-saving radiology machine that destroyed the cancer cells around that vertebrae would be subject to a 2.5% excise tax by the federal government. Why would you put a tax on the very life-saving devices that are used in medicine today? That only increases the cost of medicine. But I mean, you can go on and on as to the cost. $565 billion in new taxes. Talk to CPAs. Talk to people involved on church boards and hospital boards on this outrageous so-called Medicare tax that goes on higher income people for under income dividends, capital gains taxes.
Can the federal government require almost everyone to have health insurance or else pay a fine? Is that constitutional?
I don't think so. In fact, the 30 states are prepared to start lawsuits. I mean, it's just massive. And you know what, Kim? The Republicans have had alternative plans for years. We put through, and we control the House, association health plans that would allow small employers to come together to form massive purchasing pools, the same as labor unions, governments, and large corporations. And in the massive purchasing power, you can bring down the cost of health care. You can tailor-make what you want in that insurance policy. And this is where you get relief to people who have pre-existing illnesses. Well, we passed that twice in the House. It went to the Senate. Democrats fought it. It lost by 2 votes. In the House, on 3 different occasions, we passed a meaningful health care reform for physicians and hospitals so they don't have to pay incredible fees in premiums, let alone verdicts, and then defensive medicine. That never came up in the Senate because there weren't 60 votes to bring it up and to pass it. So, you know, all along we have had plan after plan, but it's foiled because Nancy Pelosi and the people that follow her don't want to incrementally solve a problem that's part of 1/6 of the economy. They want to control it all at once, and that's what's scary.
Now, how will the reconciliation bill, how is that different from the bill passed last night?
Well, the reconciliation bill is about a 170-page bill that is supposed to tweak the 2,800-page bill. It actually adds 1 million more people to Medicaid. It goes from 15 to 16 million people, and that's supposed to be the bill to correct it. But what we found interesting is the bill is so pervasive that the authors of it forgot to exempt such things as crutches and crutch tips from a special excise tax. So they already had to throw an amendment onto a bill that hadn't even become law to exempt those out. It's just, you know, what's most frustrating, Kim, is the fact that we talk on a daily basis with a lot of people who are desperately in need of health care insurance policies because of being denied on pre-existing illnesses. And under this bill, they're going to have to wait 4 years for any relief on that. Sure, the federal government will set up some sort of a pot for assigned risk for health insurance, but we already have that in Illinois. Premiums are high, and the waiting list is long to get onto it. But, you know, that's not fair to the people who really have a genuine problem with health insurance when the Republican plan was so simple, so incremental, so non-threatening to the entire community, and it could have helped them